fuel lid, and
Okay.
I
Fuel is fuel
fuel
is
is
half,
half,
not
not
full
full
exactly.
exactly.
It is
It is
half.
half.
Then
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 I'll
I'll
probably
probably
check
check
whether the
whether the
engine
engine
oil
oil
is
is
full or
full or
not.
not.
okay,
Okay,
then
then
it is
Then
it is
also
also
half.
half.
then
Then
I'll
I'll
check
check
whether
whether
there's
there's
any
any
issue with
issue
the
with the
battery.
battery.
Everything
Everything
checked,
checked,
everything is
everything is
okay.
okay.
Will you
Will you
try to
try to
restart?
restart?
Yeah,
Yeah,
I'll
I'll
probably
probably
try
try
to
to
restart
restart
after
after
that
that
by
by
kick-starting it.
kickstarting it.
So
So
it
it
will
will
kickstart,
kickstart.
Yes,
Yes.
yes.
right?
Right.
So
So
actually,
actually,
what
what
people previously,
previously,
because I
because I
had an
had an
experience with the
experience with the
chassis. So
chassis. So
what
what
exactly?
exactly?
Why I
Why I
mentioned
mentioned
chassis
chassis
is
is
they
they
lean,
lean,
right? They
they
lean the
lean the
bike to
bike
the
to the
side,
side.
so
So
the
the
Hmm.
petrol
petrol
comes
comes
to the
to the
action
action
point.
point.
Then
Then
they'll
they'll
try
try
to
to
kickstart.
kickstart.
Yes,
Yes.
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 yes,
Yes.
yes.
So thank you,
This
this
is
is
Sena.
enough.
Thank you so
Thank you so
much.
much.
So,
Hello.
So,
so
so
what I
what I
want to
want to
tell
tell
is
is
like,
like,
so
so
today we
today
are
we are
going to
going to
learn
learn
about
about
basic
basic
life
life
support.
support.
So one
So
thing
one
is
thing is
like
like,
basic
basic
life
life
support
support
is the
is the
most
most
important
important
thing
thing
in
in
any
any
person
person
who's
who's
having a
having a
cardiac
cardiac
arrest.
arrest.
What is
Okay.
radio?
Okay.
Sorry,
Sorry,
my
my
voice
Your
is
voice is
voice
breaking,
is
breaking,
right?
very
right?
low. Yes,
Yes.
sir.
Okay,
Okay,
my
my
voice is
voice is
breaking.
breaking.
Am
Am
I
I
audible
audible
now?
now?
Yes, sir,
Yes, sir,
you
you
are
are
audible,
audible,
but
but
only, sir,
sir,
your
your
voice
voice
is
is
breaking.
breaking.
Okay. What
What
about
about
now?
now?
So
So
it's
it's
still
still
breaking.
breaking.
Yeah,
Yeah,
just give
just
me a
give me a
minute.
minute.
Now,
Now,
now you
now you
can
can
hear
hear
me.
me.
Now we
Now
Yes,
we
can
can
hear.
hear.
I
I
think we
think we
can
can
hear
hear
you.
you.
This is
This is
Professor
Professor
Yeah,
Tupa.
am I
Tupa,
clear,
right?
right?
Hmm.
Yeah,
Yeah,
yeah.
yeah.
Thank you,
Thank you,
Deepa.
Tupa.
So
So
now,
now,
so I
so
am
I'm
going
going to
to take
take
in
in
details
details
session
session
about
about
BLS.
BLS.
So
So
actually,
actually,
BLS is
BLS
like
is like
basic
basic
life
life
support,
support
and
and
which
which
needs a
needs a
hands-on
hands-on
practice.
practice.
But
But
because
because
of
of
the
the
limitations we
limitations we
have, we
have,
are
we are
trying to.
trying to.
I'll
I'll
trying
trying
to.
to.
I'll
I'll
try to
try to
explain my
explain my
best.
best.
So
So
you
you
can
can
practice it
practice it on practice
at
it
your
your
home
home
on a
on a
pillow,
pillow,
or
or
just
just
use your
use your
pillow to
pillow to
practice it
practice
when
it
I'm
when I'm
showing it
showing
on
it
the
on the
screen.
screen.
So
So
in
in
basic life
basic life
support,
support,
why
why
I
I
got this
got this
scenario of
scenario of
Cheta
Cheta
getting
getting
stuck,
stuck,
uh,
uh,
because
because
what
what
happens
happens
like
like
in
in
any
any
patient who
patient
is
who's
having
having
cardiac
cardiac
arrest,
arrest,
first
first
thing
thing
like
like
Aditya
Aditya
Saxena
Saxena
mentioned,
mentioned,
any
any
patient
patient
who's
who's
having a
having a
cardiac
cardiac
arrest,
arrest,
first thing
first thing
we'll
we'll
try to
try to
check
check
whether
whether
he's
he's
having
having
any
any
carotid
carotid
pulse.
pulse.
That is
That is
what the
what the
fuel of
fuel
the
of the
body.
body.
So
So
carotid
carotid
pulse I
pulse I
want to
want to
show
show
you.
you.
Um,
Um,
so
so
so this
so
is
this
my
is my
body.
body.
You
You
can see
can
my
see my
body,
body,
right?
right?
So
So
this is
this is
where my
where my
heart
heart
lies,
lies,
on the left
left
side of
side of
my
my
chest.
chest.
So
So
whenever
whenever
a
a
person
person
is
is
unresponsive,
unresponsive,
we are
we are
going
going
to
to
check
check
his
his
carotid
carotid
pulse.
pulse.
Carotid
Carotid
pulse
pulse
is the
is the
pulse
pulse
where
where
which is
which is
present in the
present in the
carotid
carotid
artery.
artery.
So
So
from the
from the
heart,
heart,
there
there
will
will
be a
be a
direct
direct
blood
blood
supply
supply
to the
to the
brain
brain
through
through
carotids.
carotids.
Okay,
Okay,
so
so
that's
that's
why we
why we
always
always
say
say
carotids,
carotids
because we
because we
want to,
want
that
that
is
is
the
the
central
central
artery
artery
supply of
supply
the
of the
body.
body.
There are
There are
two
two
different
different
types
types
of
of
blood
blood
supplies. One
supplies.
is
One is
central
central
supply and
supply
one
and
is
one is
peripheral
peripheral
supply.
supply.
You, I mean,
You
you are
are
not
not
aware of
aware of
that.
that.
So
So
central
central
supply is
supply is
called
called
carotid
carotid
and
and
femoral.
femoral.
So
So
carotid
carotid
is
is
the blood vessel which supplies blood to brain, and femoral is the blood supply to the lower body. So these are the two central lines. Okay, and the peripheral lines are the rest, like in the arteries in the hand, arteries in the elbow. So these all comes under peripheral blood supplies. So we always, whenever any person is unresponsive, the first thing we try to check is his carotid pulse. Uh, so why carotid pulse? Just because if the BP is down in any person, for example, our normal BP is 120/80. So if some person's BP is around 80/60, we cannot palpate his peripheral pulses. Usually we palpate our peripheral pulses, this radial artery, so and brachial artery in the elbow. So in these positions, actually, when the BP is down, it is very hard to palpate the pulse. So that is why we always try to palpate the carotid artery for the central, to check whether the patient has a patent blood supply or not. So that is the one thing. So any person, for example, so there is another scenario. So this question is to Bhavani Kabra. So imagine there is a person who is 25-year-old, who is a colleague. Suddenly, he is, he's just sleeping. You want to wake him up. What do you do?
Sir, I will slowly call his name and slowly shake him, probably.
So what do you call him? So if you call him, if still he is not responding, then
Probably shake him a little, not too much, just a little. Probably he's just sleeping.
Yeah.
He's just tired.
so still he is not trying to respond. Still he is not responding. Then
So then I would consider that there is something wrong, and I would call for any medical assistance that is nearby. I'll get him
Yeah.
some water, sprinkle some water,
Yes.
probably.
Yes, exactly, Bhavani. So before doing that, before calling, will you try to wake him up a bit harder? So will you slap him, or or will you try to shake him a bit harder?
Not slap, but I will definitely shake him a bit harder because.
Yeah, but we usually slap because that's the most painful stimulus that the patient responds. Okay, not the slap which we see in movies, but a proper slap on the cheeks or on the chest or on the shoulders. So this is what we try to do when the patient is unresponsive. For example, if patient is unresponsive, then the first thing to do is like the shake, call with a loud voice, then try, if still he is not responding, then shake, give proper painful stimulus so that he responds. So for example, then still he is not responding. What is the next thing to do? As Bhavani said, immediately call for help. So if you are in hospital, if you are in any place which is like very far to any hospital, any medical assistance, then immediately call them. Otherwise, if you are placed nearby, for example, if you are in a IT company, then most of the IT companies have a doctors in 24. Doctors support in the morning times. If he's available, try to call him immediately. So first, always. So whenever a person is unresponsive, we'll try to make him, we'll try to make him respond. So we'll try to shake him, or we'll try to just give a proper painful stimulus on the shoulders. So I'll show you exactly how we'll do. You guys can see me, right? I think, for example, if any person is unresponsive, let's believe this is a scenario where 25-year-old person is unresponsive. The first thing I'll do is like, I'll call, let's call him Surya. So I try to call him like, Surya. So the way you try to awaken the patient. And if he is not responding, then what we try to do is, next thing we have to check the carotid pulse and his respiratory movements, like whether there is proper chest raise or not. If I am breathing, there will be always, like, you can check yourself if we all are breathing. So like there will be spontaneous chest raise for us, and along with that you can see this is trachea. I don't think we can zoom here. So you can see the center part of my neck, that is trachea. May I know Nishant Reddy? Hi Nishant.
Nishant, we are not able to hear you, Nishant.
Okay, Simran Gupta.
Yes, sir.
Yeah, Simran, you can feel your trachea in the center, right?
Yes, sir, I can.
Okay, exactly from the trachea, just try to slip towards the left or right side with the two fingers. You can see two fingers, right?
Yes, sir, I can.
Just point your trachea and slip towards left or right side. If you are doing it on doing with your right hand, go to the right side, or I mean the vice versa.
Okay, sir.
You can feel any palpating thing over there.
Yes, sir, I can.
You can palpate, right?
Yes, sir.
So that is a carotid pulse.
Okay, sir.
So I expect everyone to check their own carotid pulse. So if everyone can feel that, so that is where we try to check the pulse of a patient who is unresponsive. So first we'll try to wake him up with painful stimulus on the shoulders, and if he's not responding, then then the next thing to do is like check the carotid pulse, which we do with the two fingers of your any hand. Just put your fingers on the center of the trachea and slide to left or right. And okay, this is second. So and when you're checking the pulse, always simultaneously you have to check whether there is any chest raise or not. You can always appreciate a proper chest raise when the patient is responding. I mean, when the patient is alive. So most of the may I know any of the persons from this batch who had a hospital experience, like any of your family members got a cardiac arrest, you went to the hospital, you want to make sure whether he's alive or dead, or you want to make sure what happened exactly to him. Any such kind of experiences you had previously? I'm waiting for the answers.
No, sir.
Yes, sir.
Yes. Yes, from
Who
anyone?
just said yes? Hello. Who just said yes?
Yes, sir. Yes, sir, Suvejaya.
Yeah, yeah.
Suvecha.
So, Vecha, can you hear Dr. Teja? Can you respond?
Yes, sir, yes, sir. So just I missed out a bit. There was an internet issue at my end. So can you just repeat your question, please?
So, you had any previous experience of you going to a hospital with any of your relative or family member, whether to check because of any cardiac arrest or something, he's unresponsive, and you took him to the hospital. Is there any kind of such scenarios in your life so far?
No, sir.
Okay. So what happens, like, as an emergency physician, I see a lot of patients and their attenders. Like, for example, if any person is unresponsive, so they'll try to get him to the hospital. They don't know whether he is dead or alive. So they actually they'll come from a distance where the hospital is more than 10 kilometers away. They once the patient gets unresponsive, he'll take him to they'll call for any ambulance, or they'll take their own vehicle and get him to the hospital, and the time will take at least 30 to 40 minutes for the patient to reach hospital. In the meanwhile, if the person or the patient attender knows what to do in such scenario, we can survive the patient. So that is why all the people, like, whatever your management is trying to help you with this basic life support, so that it will help you in your further in your future. So that is the exact motto of your management, and as well as our emergency department in India. So we are trying to teach more of these BLS sessions. So these kinds of scenarios will be taken care of. So what happens? I'll tell you an example. So yesterday we had one patient. He is close to 50-year-old, and he became unresponsive at home. And after that, actually he became breathless initially, and after that they took him to nearby clinic. That is an RM, quacks, right? RMPs and all. They took the patient to them, and after that, once you know how in what we call this quacks, what they'll do, they'll try to treat him with the proper normal medication. They treated him with normal medication. After that, the patient got unresponsive there itself. After that, the patient was taken from there to here. It took them 1.5 hours to reach our hospital. And once the patient comes here, his body is cold, his body is rigid, and he is dead. So if the family members, they are well educated, two of the patient's sons, they are a proper one is in an IT sector into the marketing or some other, and the other person is also educated, but even they don't know what exactly things to cover or to do in such scenarios. So for example, let's take the same scenario. If the person is unresponsive, the first thing we'll do, we'll try to check his response by on the shoulders. If he's not responding, then the next thing, check with the carotid and chest raise. If there is no carotid pulse and there is no chest raise, then immediately call for help. Call for help means, call for help is like proper help. That is like any hospital which is having an emergency department. Ask them if you are in an urban setup, or if you are in a rural setup or somewhere in the rural part of India, then you try to call the nearby PHC for a doctor or for nursing staff or a trained person who can handle such scenarios immediately. Right now, you can call for the universal, the Indian emergency number, that is 1075, or you can call for 108 in India, in Hyderabad. So after that, in the meanwhile, the help will arrive. It will take at least 35 to 40 minutes, or it will take 40 minutes for you to reach the hospital. In the meanwhile, this BLS helps. If there is no BLS taken place in between these 40 minutes, even though if you take him to the hospital within 20 minutes also, the patient survival is zero. We cannot survive the patient. So if you BLS is the most important thing in any patient who's unresponsive or any patient who's having a cardiac arrest. So I think I'm clear on this. So this is why you're going to know about what is BLS and how to do BLS and what are the things to be taken care of. And the second thing what you're going to learn in the session is how to respond when a patient is having chest pain. And third thing, I know most of the people are aware of this stroke that is called paralysis. So how to respond and how to take care of a patient who's having paralysis. That is the third thing we're going to know about it. And one more thing we are going to discuss today is like you all know disasters, right? May I know Aman Kumar is in? Aman Kumar?
Yes, sir. Yes, sir.
Hi Aman Kumar, have you heard about a disaster recently?
No, sir.
Disasters. Where are you from?
Patna.
Okay. So disaster is something. So recently there was an attack in Pathankot, right? I mean, recently last 4 years back, there was a terrorist attack.
Yes, sir.
You heard of it, right?
Yes, sir.
So in terrorist attacks or in earthquakes, or otherwise in any flood situations, or otherwise in a bus accidents where like mass casualties will be present. So that is where will be exact. I mean, you have to know like the which patient need which kind of care. So for example, the person, if like 10 people are there and you cannot take 10 people to the hospital at the same time, so you need to know what patient has to be taken to hospital immediately and what for what patients we can wait. So that is what we are going to learn for how to triage in a disaster scenarios. And one last thing we are going to learn about is like how to react for road traffic accidents. So these are all the things which we are going to cover today. And the first thing and the foremost thing is the basic life support. So like I mentioned, so any person who is unresponsive, try to, I'm repeating is, I'll repeat it and repeat it. So because this is online session and I mean, it is very hard for you to do a hands-on practice at home. So that is why I want to make it clear that always if any person is unresponsive, try to give him a painful stimulus on the shoulders. If he is not responding, check for his carotid pulse that I already told you how to check it. And if there is no carotid, I mean, you have to check the carotid pulse simultaneously with the chest raise. And if there is no chest raise plus carotid pulse, then call for him and help immediately. If you are in Hyderabad or some other states, I mean, in the capital city, you can call for the nearest hospital. And in the meanwhile, you are going to do a CPR. And if there is no chest raise plus carotid pulse, anyone know the full form of CPR? Hyderabad or some other states, I mean, in the capital city, you can call for the nearest. Any one of you, and in the meanwhile, you CPR. Have you heard of CPR previously? Anyone know the full form of CPR? Dinakar? Yeah. Yeah. Do you know what exactly CPR means?
Yes, sir.
CPR. Have you heard of CPR previously? Abbreviation of CPR.
Sir, I'm not sure about the abbreviations, but I know what you're supposed to do when you are giving the CPR. Like a rough idea.
What exactly CPR means? Okay. Thank you, Dinkar, and thank you, Vani. So what we are trying to do is like it is just there in the name itself. CPR is nothing but cardiopulmonary resuscitation.
What you're supposed to do when you are
So
giving the CPR.
cardio is heart,
Like a rough
pulmonary
idea.
is lungs. And resuscitation is like we are trying to get the things back. It's just there in the name itself. CPR is nothing. For example, what happens in a patient
What you're supposed to do
so having cardiac arrest. Cardio is heart,
like a rough
pulmonary is
idea.
lungs. Think. And resuscitation is like we are trying to get the things back. It's just there in the name itself. CPR is nothing. For example, what happens in a patient
What you're supposed to do
having cardiac arrest? It's not Supreet Dasi.
Yes, sir.
Hi Supreet, can you please tell what you think will happen in a patient who's having cardiac arrest? Supreet Dasi.
Sir, as far as I know, there is insufficient blood supply
Can you please tell
that is
what
going
you think
on.
will happen? So how we get blood supply? Supreet. So for my hand to work, so
As
my
far as I
hand
know,
needs a blood supply. How will
there
get the
is
blood supply?
insufficient blood supply
Yeah,
to heart
heart
pumps.
pump.
Yeah.
heart, and there comes the blood supply to our whole body. And in cardiac arrest patients,
As far as
what
I know,
happens? The
there is
heart
insufficient
will
from blood supply
get,
to
yes,
heart
it
function.
won't pump.
Yeah.
So then what we'll do, I already told you the example of a Royal Enfield bike. If it is not working, then we'll try to kick start.
Insufficient
Right.
from blood
So
supply
we are trying to
to heart
kickstart the
function.
patient by giving
Yeah.
compressions on the chest. Exactly on the center of the chest, we'll try to compress so that we can work on restarting the heart function.
To heart
So,
function.
do any guys, I mean, anyone know what is the reason for heart to stop functioning? We can work on restarting the
Blockage
heart
in
function.
vein.
So, do any guys, I mean, anyone know in the blood supply? What else? Aditya,
Fat deposition in
Blockage
artery.
in vein.
sorry, fat.
Deposition in artery.
Yes, yes, yeah. That is all. That is all. I mean, there are. These are also one of the reasons. What is the main reason?
Fat deposition in
Blockage
artery.
in vein.
So what we need
Deposition in
to
artery.
leave. Yes, yes, yeah. That is all. That is all. I mean,
Oxygen.
yes. There are. These are also one of the reasons. Nice one, Aditya.
Fat deposition
So
in artery.
oxygen. Okay. So whatever reasons we are going to have
Deposition
this
to
cardiac
leave.
arrest, the first and foremost reason for the cardiac arrest is lack of
Oxygen.
oxygen supply to heart and to brain. So because of lack of oxygen supply, it is called hypoxia. Our brain function will get low, and after that it will affect on heart. Whatever may be the reason of cardiac arrest, okay, hypoxia will be the first in the row. Hypoxia, that is called lack of oxygen supply to the body, is the most primary cause of cardiac arrest. So that's why what we are going to do, for example, if a bike, for the bike, if bike has to function, it need petrol, right? Petrol or whatever fuel it is going to. So that is why our body fuel is oxygen. So this has to be in your mind till the end of, I mean, not this session, in the future also. Our fuel is oxygen. So what we do if the bike is not working, we'll lean the bike, and after that we'll try to kickstart. So now what we'll do in this BLS workshop is we'll try to provide oxygen to the patient, and we'll try to lean the bike, and after that give proper compression. And Suprita Dasi, sorry, Suprita Dasi, Suprit Dasi, sorry.
Yes,
And
sir.
we'll try to uh, Suprit Dasi, have you seen any person giving compressions to unresponsive patients so far? In movies, so far, or in
Yes.
movies, or anywhere.
Yes, sir. In movies, I have seen, but not.
Okay. How many of you guys saw this? What we call giving electric shock to the patient in movies?
Yes, sir. In movies, I have seen, but not.
Bhavani. Yes, nice. So we also giving shocks in movies. That is not the actual and correct thing to
Yes,
do,
sir. In movies,
because
I
most
have
of the
seen,
people are not aware of
but
what
not.
exactly not what exactly has to be done. They'll show in movies that we need to give electric shock that will help the patient to get regained or something. So that is not the exact thing to do in hospitals.
Yes, sir.
So I can see patients coming to our hospital and asking for an electric shock to give to patient so that he'll get back his life. So that is not exactly thing to do. So I'll tell you, I'll explain you. So how to do CPR first initially. So this is my chest. You can see. You can all see my chest, right?
patient so that he'll get back his and I think you all guys have the basic anatomy. So this my center part of the chest is called sternum. There is a bone called sternum. Okay, so you can everyone please palpate your sternum from you all guys end of the trachea. So it is the sternum starts. Please palpate the sternum called sternum, and at one point you won't feel the sternum. Everyone where the chest will be very soft, you all guys right of the trachea. So everyone felt it. The sternum starts.
Yes,
Please
sir.
palpate the sternum called sternum. So we will give the compressions at the center of the sternum when because there will be the heart. Okay, whenever
Yes, sir.
we're giving compressions, first thing you need to make sure you always have to give the compressions with the base of the palm. So base of the palm should be on the center of the sternum, and you should
Yes, sir.
make the fist together. Okay, and you can see my hands, right? Your hands should be so your base of the palm should not be flexed. They should be straight. And whenever you're pumping, make the whole body other. I mean, your whole upper body has to put the weight on the patient's chest. I'll show you now how exactly they should be straight. And whenever you're pumping, everyone can see me. I mean, your whole upper body has to put everyone can see me, right? On the patient's chest. I'll show you now. This is the patient's chest. This is the patient's chest. So from here to here, this is sternum. So this is at the center of the sternum. I will raise my both fists together, and with the base of my palm, so I am trying to give pressure. So this is at the center without folding my elbows, without flexing my elbows. I'll try to give compressions of my palm. So I am trying to give pressure. Total weight of my upper body on the patient's chest. I'll try to. Okay, this is how we'll compress the patient's heart. Total weight of many of the people upper body will do it improperly, which will lead to ineffective way of cardiopulmonary resuscitation. So I want to re-mention one thing. We are doing a cardiopulmonary resuscitation. We are trying to restart heart by providing oxygen. So pulmonary is nothing but providing oxygen to the lungs and giving proper compression. So these two things we won't do simultaneously. So in basic life support, what we try to do? We'll try to give oxygen to the mouth and give compression on the chest. So this is what we try to do in a cardiac simultaneously. So I want to know from Nishant Reddy, give oxygen to the mouth and give compression on the chest. So this is what we try to do in a cardiac simultaneously. So I want to know from
Yes, sir.
Nishant Reddy. I have said. So if I am giving compressions, can I give the oxygen simultaneously?
Sir, you need to stop and give it CPR for mouth to mouth. Yes, sir.
Yes, fairly. Thank you so much, Akshay. But if the patient is having an intubation, is having a pipe in, if he's already,
Sir,
for example, in hospitals, we'll give it simultaneously. But in basic life support, what we should do, we should give 30 compressions on the chest, followed by 2 respiratory efforts. Okay, and most of the people in scenarios where the patient is having cardiac arrest, there won't be any mouthpiece to give oxygen. So the only way to give oxygen is to mouth to mouth. Can I give, if, for example, if I want to give oxygen to some other person, if I just blow in his mouth, will that be sufficient for the oxygen requirement he will have? The only way to give oxygen is to mouth to mouth. can I give,
Sir, I think it
for
should be a
example,
continuous.
if I want to give oxygen to some other person, if I just saying something, Akshay, come on, will that be sufficient for the oxygen requirement to have? Carry on, Akshay.
Sir, I thought you were asking from me.
Can I give,
Sir,
yeah,
it
it's
should be a
okay,
continuous
carry
process.
on.
One or 2 minutes. Continuous
If I just
process.
saying
First
something,
stop,
Akshay, come
continue
on.
again. Stop, then again.
Okay, for example, if I want to blow air into someone's mouth,
Sir, I thought you were
so what
asking
is the
from me.
process? What are the
Sir,
things
it should be
I
a
should
continuous
take care of?
process. One or 2 minutes. Continuous process. Sir, it should not continue again. Stop. The mouth should be covered. The air should go
Okay,
properly into mouth.
for example, if I want to blow air into someone's mouth, the
Sir, I
mouth
thought you
should,
were
the
asking
air
from me.
should go properly straight into his lungs.
One or two
What
minutes.
happens in a cardiac arrest
Sir, it should not
patient or
continue
patient
again.
who is
The mouth
unresponsive,
should be
our
covered. The
tongue,
air should go
the
properly into
tongue
mouth.
will fall back. Exactly. The mouth should, if the tongue fall back, it will go and obstruct the oronasal passage into the trachea.
The mouth should be covered.
So even though if we give proper air into the mouth, still the air won't reach the lungs. So to make sure that the sufficient air reaching the lungs. So what we do, what happens? My tongue is obstructing my throat after falling back. What we try to do, we'll try to lift it. So after that, what happens? The tongue will move away. The mouth and throat into the lungs will be in a straight line. So after that, we'll give proper air. So I want everyone who's attending this class to make sure, whenever, if necessary, if you're giving breaths to any person, oral mouth to mouth, first thing you need to make sure. So after that, the patient head. So I want everyone who's attending this class to make sure, whenever, if necessary, if you're giving breaths to any person,
సో నా పేరు కార్తీక్ అండి. మార్నింగ్
try
కాల్
to
చేశాం కదా.
make sure after that, the patient head.
ఏం లేదు, ఇంట్లో అదేంటి రెడ్ కలర్ అంటే ఉంది అని నాకు చెప్పాను, బాగానే ఉన్నాను, కానీ నాకు రెడ్ సరిగా అవ్వదు అన్నారు.
So
నాకు
that is
వాళ్ళు చెప్పిన కలర్స్ లో ఏంటంటే బ్లాక్, గ్రీన్, నీలం కలరు, ఎల్లో కలర్. ఇంటిలో తీసుకోమన్నారు. ఇంట్లో ఏం చేసినా కానీ ఎల్లో ఒకటే ఉంటుంది.
person who is
నాకు వాళ్ళు చెప్పిన కలర్స్ లో ఏంటంటే నాకు ఇయర్ది ప్రాబ్లం చేస్తూ ఎల్లో కలర్. ఎందుకంటే గవర్నమెంట్ ఎప్పుడైనా రూల్స్ మార్చవచ్చు. ఆ 15 సంవత్సరాలు అనేది ఒకరోజు అటు ఇటు అయినా అవ్వచ్చు. దానివల్ల నాకు కరెక్ట్ ఏం లేదు. 2020 మన కరెక్ట్ అనేది గవర్నమెంట్ ఎప్పుడైనా రూల్స్ కాబట్టి నాకేంటంటే 8వ తారీఖు తర్వాత అంటే 2 నెలల రోజులు తీసుకునేది లేదని నిక్కచ్చిగా చెప్పేసి, దానివల్ల నాకు అది నా ప్రాబ్లం వచ్చింది. అదో ప్రాబ్లం అయింది కోసం కరెక్ట్ అనేది కాబట్టి నాకేంటంటే 8వ తారీఖు తర్వాత అంటే 2 నెలల రోజులు తీసుకునేది లేదని నిక్కచ్చిగా చెప్పేసి, ఓకే అది నా ప్రాబ్లం వచ్చింది. అదో
So this is called mouthpiece, and we'll place it. This is exactly in the shape of an organ.
ఇమ్యూనిటీ చేస్తే ఏంటంటే కొటేషన్ ఏంటి పంపిస్తే రోగి పెట్టుకోవాలి.
This is the right way to keep it. The shape of the bus. You have to put it on the patient's face if you are carrying it. After that, you need to make sure
ఇమ్యూనిటీ చేస్తే
every part
అదేనండి ఎంతో చూడండి. అందుకనే అది
seats properly on the face. Okay. After that, you need to do a head tilt in the position. And after
ఓకే. ఓల్డ్ అంటే 2019.
so I'll demonstrate this on the patient mannequin so that you will all get to know how to do it on the face.
ఓకే 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 ఓకే. అప్పుడు ఇయర్లో ఎప్పుడు వచ్చినా అదే ఇయర్ కదా, జనవరి నుంచి డిసెంబర్ వరకు.
Keep it on the patient's face. After that, try to
ఓవరాల్ గ్రూప్లోనా? ఓకే, ఒకసారి కనుక్కోండి. అప్పుడు ఇయర్లో ఎప్పుడు వచ్చినా అవునవును
you'll do with the patient.
ఓకే సార్, కనుక్కోండి సార్. ఓకే సార్, ఇయర్లో ఎస్ సార్. ఓకే సార్, థ్యాంక్ యూ సార్.
Most of the people, what happens is they're starting, they're very new to basic support. Always the best possible way to give proper breath
ఓకే సార్, ఇయర్లో
go on the patient. compression, and after that, this is the exit and chin lift position. You can give mouth to mouth breaths to the patient. For example, if you have to breathe from the side of the patient, you have to do this. So with the two fingers, you need to lift the chin lift position with the head grip with the other hand. And after that, you give proper breaths to the patient. But once you are giving the breath, make sure that the mouth of the patient is properly open. And after that, once giving breath, you don't use any air outside. You have to be very proper while breathing the air, so that there is a proper seal between your mouth and the patient's mouth. If you're carrying a mouthpiece, you can just do this. Just head tilt in one hand and chin lift with the other hand, so that the airway is clear from mouth without the tongue obstruction. And after that, you give the breath to the patient. So in cardiopulmonary resuscitation, what we are going to do is trying to restart the heart functioning by providing oxygen supply to the body. So these are the two things which are very primary and which are very important in giving a BLS care to any person who is under smoke. So I'll try to I'll just restart from the starting. For example, this is the very person which called away and he is not responding. So what I'll try to do, and the first thing I try to do is like I'll try to wake the patient. I'll just restart from the starting. For example, take the carotid pulse simultaneously with the respiration. So what I'll try to do, if there is no chest rise and there is no carotid pulse, the next thing to do is call for help, and simultaneously you need to start the CPR. And I'm starting the CPR. What is the exact basis no CPR? So I do 30 compressions. So I have to just take how I'm doing. So my chest is parallel to the patient's chest, and always make sure whenever you are doing CPR, the seat has to be safe. For example, if you are in a position where there is like an earthquake or there is some glass surroundings, you need to make sure that the seat is safe. If the seat is not safe and there are fires being on the sides, you cannot do a CPR.
అక్కడ షోరూమ్కి వెళ్ళి రావా ఏదో షోరూమ్కి ఒకసారి
Because I need to show you, I'm seeing on a stretcher on one side and there are playing on a stable case. You can always put it on the floor. Make sure you kneel down. When you proper pressure, like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. You can always put it on the floor. Make sure you kneel down. Like 1, 2, after 30 compression, 5, 6, 7, 8, 9, head tilt, chin lift, and give 2 breaths from mouth to mouth. And after 2 breaths, you need to check after the breath whether there is simultaneous chest rise or not. If there is no chest rise, that is meaning that you have not given a proper breath to the patient. So that's why always when you give it,
కలర్ అయ్యి
the head is
అవైలబిలిటీలో లేవు అంటారు అమ్మో ఎల్లో తీసుకోమంది ఎల్లో కానీ గ్రీన్ కానీ ఏం లేదు ఏదో కలర్ నీలం కలర్ కానీ బ్లాక్ కానీ అక్కడ లేవు అంటారు అక్కడ ఏమైందంటే బ్లాక్ లేదు అమ్మో ఎల్లో తీసుకోమంది ఎల్లో కానీ గ్రీన్ కానీ ఏదో కలర్ నీలం కలర్ కానీ బ్లాక్ కానీ అక్కడ లేవు అంటారు అక్కడ ఏమైందంటే బ్లాక్ లేదు
you can patient got pulse, patient got then that is mean the patient got stable. If there is no pulse, then again start CPR and after the compression you breathe. After again you check the pulse. Till how long we do this? Will be the patient got stable. The baby is we get any help. There is no pulse. The help error. If there is no help error, otherwise if the patient responds, then stop the otherwise if the patient
స్నానం చేసి
for example, if you have done this CPR for almost like 40 minutes and you got exhausted, there is no response, then you
వాళ్ళు మాట్లాడుకుంటూ
first thing whenever you are doing compressions, everyone is to take the pulse, and if you can feel the pulse, then what's the next thing? Okay, you can feel the pulse, you need to wake the patient again, and the patient is not waking up, and there is still pulse. Whenever you are doing compression, try to put the patient in and you can recovered position. Then what's the next thing? You try to put the patient onto the left side, one leg on the other side. Whenever you are doing compression, try to one hand patient on the other side. These are the two things we try to do. This is called recovery position, and demonstrate at the end. So when I stop the CPR, so whenever the patient recovers or he gains pulse or the help arrives, or you cannot give more effort. For example, you are exhausted giving CPR for almost 30 to 40 minutes. So CPR is like, so whenever like a heavy purpose, so if you are so much exhausted, then you can stop giving CPR. So give more effort. For example, you are exhausted giving any experts ask you to stop, then you can stop the CPR. So this is the demonstration. Then I'll share the PPT. Then we can discuss for any doubts or questions. So let's start the PowerPoint. So if you got any doubts, please just ask. We can discuss for any doubts or questions. Everyone can see the screen, right? Start the PowerPoint. So if you got any doubts, please.
We can see the screen, but yeah, we can see the PPT now.
Yes. Everyone can see the screen, right? Start the PowerPoint. So if you got any doubts, please.
We can see the screen, but yeah, we can see the PPT now.
Just a moment, okay? Everyone can see the screen, right? Start the PowerPoint. So if you got any doubts, please.
We can see the screen, but yeah, we can see the PPT now.
Just a moment, okay? Everyone can see the screen, right? So if you got any doubts, please.
We can see the screen, but yeah, we can see the PPT now.
Just a moment, okay? Everyone can see the screen, right? So let's start with the PowerPoint. Just a moment, okay? So what is BLS? What is basic life support? So I already told you previously, basic life support is a level of
5 నిమిషాల నుంచి కొట్టుకుంటున్నా నాకు సిగ్నల్ సరిగ్గా లేదు ఇక్కడ
healthcare
ఇప్పుడు
providers
మళ్ళీ
and
వచ్చింది
public safety
ఏంటో మరి సిస్టమ్ ప్రాబ్లమా ఫోన్ ప్రాబ్లమా
It's not about responders or healthcare providers. It is like any
ఏం
level.
లేదన్నా అమ్మో ఇచ్చిన కలర్ ఆప్షన్ లో 4 ఇచ్చింది నాకు బ్లాక్ గ్రీన్ నీలం ఎల్లో వీటిలో బ్లాక్ గ్రీన్ లేవు నీలం అంటే అన్నయ్య బండి కలరు కానీ ఆ కలర్ లేదు వేరే బ్లూ ఇచ్చింది నాకు అయితే బ్లూ కానీ ఎల్లో కానీ అడిగితేనేమో అది ఎక్కువగా తక్కువ మంది తీసుకుంటారు ట్రెండీగా బ్లాక్ గ్రీన్ లేవు జనరల్ ఆడియన్స్ రెడ్ వీటి మీద వెళ్ళిపోతారు సార్ కలర్ కానీ ఆ కలర్ లేదు వేరే అన్నాడు పొద్దున ఇంకోసారి అడుగుతానని ఇంట్లో అడిగితేనేమో మరి నీలం అంటే అది లేదమ్మా మామూలు బ్లూ ఉంది కానీ ఆ బ్లూ లేదు జనరల్ ఆడియన్స్ రెడ్ వీటి మీద వెళ్ళిపోతారు సార్ ఏం చేయాలి అంటే పసుపు అయితే బాగుంటుంది అది అన్నాయి అసలు అంటే చూడటానికి వాడు అఫీషియల్ కలర్ ఎల్లో బ్లూ ఉంది కానీ ఆ బ్లూ లేదు జనరల్ ఆడియన్స్ ఒక్క నిమిషం అసలు అంటే చూడటానికి వాడు అఫీషియల్ కలర్ ఎల్లో బ్లూ ఉంది కానీ ఆ బ్లూ లేదు
That is not the right way, but that
Okay. So what exactly so like so once our mouth is passed, there will be one is food pipe and one is air pipe. Food pipe is the one which is called esophagus, which will be directed towards the abdomen called sternum. And the second one is the air pipe, that is called windpipe. So that will be directed to the lungs. Okay. Whenever any solid object will be directed towards the abdomen called sternum. in the second one is the air pipe, then it is called choking. So that is and if the windpipe is blocked, it will be very hard for any person to take the oxygen inside. Then after some time, because of the lack of oxygen to his body, he'll be having a cardiac arrest, or he'll be having an oxygen because of that he'll be having cyanosis. Cyanosis is nothing but blueness of the face or the body. Okay. To make and what are the things we need to take care in that such scenarios? I'll just try to try to tell what exactly what are the exact ways to do that. So if the scenario is for an adult person, so for adult persons, try to tell what exactly. So Simran, what are the exact ways to do that? So if the scenario is for an adult
Yes,
person,
sir.
so Simran, adult persons, try to for example, so Simran, if any person have you I mean, are you a non-vegetarian or a vegetarian?
Yes, both are a vegetarian.
Simran, uh, so if there is any water pipe, you and I mean you water your plants.
Yes, both are a vegetarian.
Simran,
Also, I don't water that.
so if the pipe got obstructed, what will you do at home? And I mean you water your plants.
Yes, both are a vegetarian. Also, we don't water the plants through a pipe.
So
We
if
just
the
have a
for
filter.
example
Yes,
you sink at home,
yes, sir.
water sink.
Yes.
For example, any time if
Also,
the
we
water
don't
sink got
water the
obstructed and
plants
water
through a
got blocked,
pipe.
so
We just have a filter.
you'll call the plumber.
Yes,
So
sir.
what the plumber will do? Did
Yes, sir.
you observe any time?
So he will clean the pipe or the drain, whatever is causing the blockage.
How
We just so he has certain
you'll call the
instruments that he
plumber.
uses. Yes,
So
sir.
what the plumber will do? Did
Yes.
you have you anyone
So he
of
will
the
clean
guys
the
have
pipe or the
seen
drain,
how the plumber
whatever is
cleans
causing
the
the
sink?
blockage.
How
We just so he has certain instruments that he
Yes,
uses.
sir.
Yes.
Isha,
Yes.
have you anyone of the guys
The
have
pipe or
seen
the drain,
Mayank, right?
whatever is causing the blockage.
Yes, sir. My on this side.
Yeah.
We just
Hi
so
Mayank,
he has
have you
certain
seen the plumber cleaning the
instruments
sink?
that he
Yes,
uses.
sir.
Yes.
What he'll
Yes,
do?
sir. So they have that
Uses
suction cup
Mayank, right?
attached to a this. Yes, sir. My on this side.
Yeah.
I mean,
Yes.
yeah. So they use a
Yes,
suction cup
yes, the
to
suction
hold it
cup.
from
Yes,
below and
exactly.
yeah.
Suction cup will
Yes,
do.
sir. Yes, sir.
What he'll do,
So they
he'll
have
try
that
to
suction cup.
Mayank, right?
He'll put the
Right.
suction cup on
Yes, sir.
the sink and he'll keep pressing so that
Hi
the
Mayank. Yeah, so they
this one
use
the
that
dirt
suction
comes
cup.
out of the
Yes,
water
suction cup.
and
Yes,
yeah.
exactly.
Yes,
Exactly.
yes,
Exactly.
yes, sir.
Thank you so much. So, what is the mechanism in that?
Cup. He'll put the
Right.
suction cup on
Yes, sir.
the sink. Basically, the air sucks out the dirt from inside.
Yeah,
The lack of air
mechanism
sudden.
inside. What is the mechanism inside that suctioning? So,
It's
what
a
is the
vacuum
mechanism in
and it
that?
creates a vacuum and then suddenly air fills into everything.
Yes, yes.
So basically, the air sucks
So
out
he'll
the
try. There will be a
dirt from
pressure
inside.
gradient.
The lack of air sudden.
There will be a pressure gradient from one to, I mean,
It's a vacuum.
between the two
Creates a
chambers.
vacuum and then
So
suddenly
that
air
is
fills
what
into
we are
everything.
trying to do.
So basically,
So what will we do?
the air
So you can see me on you can see what is visible on the screen, the PPT or me? From one to, I mean, between the two
creates a
chambers.
vacuum and then
So
suddenly
that
air
is
fills
what
into
we are
everything.
trying to do. So
Basically,
what will we do?
the air
You can see PPT is visible. Okay. You can see what is visible on the screen, the PPT. You can see me right. From one to, I mean, between the two chambers.
Yes, sir.
So that is what we are trying to. So what we try to do. So usually, so these are my lungs. Okay, and a small solid object got obstructed in my airway. So I want to push it out. So what I need to do? So I'll put some pressure on my abdomen. So on my diaphragm, I'll put some pressure, giving pressure on my abdomen. So that will lead to a positive pressure in my lungs and a negative pressure outside, which will lead to which will push the solid object from the airway to the mouth. So that is what we try to do in a person who is choking. So what exactly I do when any person is choked? So how will we get to know that the person is choked? He'll try to tell that if the person is choked, he'll be I mean his chances of speaking, he'll be unable to speak, or even though he's speaking, there'll be very narrow air coming out of his mouth, or he's unable to breathe, or he'll show something like this. So this is called universal choking sign. He'll try to explain you that he is unable to breathe or he's unable to speak, and the next thing to do, air coming out of his mouth, see, I will show you how exactly he'll show something like this. So this is called universal choking sign. He'll try to explain you that he is unable to breathe. This is the person who's standing, and the next thing to imagine this person is standing. See, I will show you how exactly he'll show something like this. So this is called imagine choking sign. This is a standing person. So to my comforts, I'm making it sit. This is the person. But whenever you want to relieve a person who is getting choked, so I'll try to hold my face with the other hand. Okay, this I'll try to. So, but whenever the fist to relieve it upwards and inward, so I'll try to. So this will create a pressure which will push the lungs to explore these objects which are in the airway outside. So what I try to do, I'll hold the person from behind with one fist, pointing his face to the sternum, and I'll hold this in the other hand, and I'll try to push upward and inward until the object comes out. Face to the sternum, and I'll hold this in the other hand, and I'll try to push upward and inward until the object comes out. Got it right? Face to the sternum, and I'll hold this in the other hand. So Tejal Savarkar. Tejal Savarkar. Got it right?
Yes, sir.
Yeah, hi. Hi Tejal, for example, I'm trying, there is one person who got choked and he wants my help, and immediately I did this maneuver. It is called, I cannot pronounce it properly. It is called Heimlich maneuver. So and after that, I'm doing and he wants my help. Suddenly he became unresponsive. So what is the next thing? What is the next thing you'll suggest me to do? Pronounce it properly. It is called Heimlich maneuver. So and after that, he became unresponsive suddenly, but the obstructed object didn't come out. So what is the next thing? What is the next thing you suggest?
I guess that is done by a standing person. I will make him stand and press his back
suddenly, but
so that the
obstructed object didn't come out. So what is the I'll tell you one thing. He's already standing.
I
I'm
guess
trying
that
to do the
is
Heimlich
done by a
maneuver.
standing person.
I'm putting
I
some
will make him
pressure to
stand
make
and
the object come outside, but in the
press
middle,
his back
he becomes
so that the object
and he's not moving his hands. He just became he just slided his on the side, putting some pressure to make the he's unable to respond anything. Then what is the next step to be taken care of? And he's not moving
if
his
after
hands.
trying a lot, still he's not responding, I think we should call for help. That's
He's unable to
what
respond anything. No, Tejal, actually, he is responsible in the starting. So he told that he
if
got
after
choked,
trying
and
a
after
lot,
that,
still he's
you
not
did this Heimlich maneuver.
responding, I think we
And
should
after
call for
that,
help.
once you're done in between when you're doing this maneuver, he suddenly became unresponsive because when he was the one who told you that he got soap, and in between of the procedure he became unresponsive. Then what is the next thing to do? Once you're done in between when you're doing this maneuver, he suddenly became unresponsive because when he was the one who
Sorry,
told
sir.
you
I'm
that
not
he
able to
got
get
soap,
it.
and in between of the procedure he became unresponsive. What we are trying to explain here is, so what is the class we are talking about? What is today's session?
Sorry, sir. I'm not. This is basic support that we can give, like emergency aids that we can give to any
What is the
patient.
class we are talking about? Yes.
We
So
didn't
in
got it.
the starting, what I told you. So what I told you guys
This is
that any person,
basic support that we can give, like
yes,
emergency
any person who's
aids that we can
unresponsive,
give
what is
to
the
any
next thing to
patient.
do?
Okay, sir.
Yes.
Yeah, yeah,
We
yeah.
So
didn't
So
in
if
got it.
any
the
person
starting,
is
what I
not
told you.
responsive, so
So
we'll
what I told you guys
give a
that any
CPR
person.
and check
I want to step clear. Any person who want to step right with you, first you'll try to
okay,
make him
yeah, yeah,
responsive
yeah.
with the
So
painful
if any
stimulus of his
person is
shoulders.
not responsive, yes, so we'll painful stimulus will
After
give
that,
on the back, and we'll check if his
step
chest is
clear.
rising
Any
or not,
person who want to step
and
right with
then
you,
we'll
first
also
you'll
check his
try
carotid
to
pulse.
make him responsive with the painful
Yeah,
stimulus of his shoulders. We'll check carotid pulse
yes,
simultaneously with the
painful
chest rise.
stimulus will
After
give,
that,
yes, yes, on the back, and we'll give
there is no.
compression, and then also turn up.
Yeah, yeah. And if there is no pulse and no chest rise, then we'll try to call for help
Yes,
because that
yes,
is the
and
scenario
we'll give
where
compression,
we cannot
and then
recover the
also turn up.
patient on our own. So we need help. So we are trying to do this BCLS to make sure the patient is having a proper blood supply to the body till the help arrives. So that is
Help
what
arrive.
exactly basically we need help. Right.
Yes,
So because I want the steps to be very clear. First you'll try to shake or try to give a painful stimulus on the patient, and if he's not responding, we'll check the carotid pulse and the chest rise, and if there is no pulse with chest rise, then we'll call for help immediately. First you'll
yeah.
try to and
Simultaneously,
or
we'll
try to give a painful stimulus on the patient. And if he's not start the CPR. Check the carotid
yeah,
pulse.
yes.
What is the ratio of CPR? Pulse with chest rise. Then we'll call for help
We'll do
immediately.
30 compressions
Yes.
followed by two mouth breaths.
Yes. And
Yeah,
what
yes.
is the rate? Thank you, Tejal. Thank you so much. So
We'll do
at what rate
30
we'll give
compressions
compressions? That is like for 1 minute we
followed by
should
two
try
mouth
to give at
breaths.
least 100 to 120 compressions.
And
At least
120.
100. What is the rate? Thank you,
Yes.
Tejal. Thank you so much. Thank you, Tejal. Thank you so much.
We'll
At
do
what rate
30
we'll give
compressions
compressions? That is like for 1 minute we
followed by
should
two
try
mouth
to give at
breaths.
least 100 to 120 compressions.
And
At least
120.
100. What is the rate? Thank you,
Yes.
Tejal. Thank you so much. Thank you, Tejal. Thank you so much. At what rate we'll give compressions? That is like for 1 minute we
Followed by
should
two
try
mouth
to give at least 100 to 120 compressions. And at least 100. What is the rate? Thank you,
Yes.
Tejal. Thank you so much. Thank you, Tejal. Thank you so much. At what rate we'll give compressions? So I think all can able to see the screen PPT. So just to have the numbers like why BLS approximately 2 million cardiac arrests per year in India, and survival to hospital discharge is approximately 5 to 10% PPT. So and coming to bystander CPR intervention before arrival of emergency services will double or triple the chances of survival from sudden cardiac arrest. Approximately 5 to 10%. Any person who is having cardiac arrest, so before what used to happen, they'll be taken to hospital when the person is having chest pain or something. And most of the people, almost like 60% of the people, think that any chest pain. If any person complains of chest pain, first thing we think of is like, or we diagnose as gastritis. People say just because of the gas, most of the people almost kind of issues, they'll come to hospital after if they are having a proper knowledge, they'll come to hospital immediately within 30 to 40 minutes, or some people will take 6 to 7 hours to reach the hospital. So after coming to hospital, if the patient is having cardiac arrest, we almost lost a crucial part of his life also. So the survival to hospital discharge of the patients, among 100%, we are having only 5 to 10%. So if we do a proper CPR who's having cardiac arrest to any person who's having cardiac arrest, then there are chances of tripling or doubling or tripling the chance of patient survival. And early resuscitation and prompt defibrillation can result in more than 60% chance of life. And early resuscitation and prompt defibrillation can result in more than 60% so what all guys going to learn in this session is like AHA chain of survival and steps to be followed while providing CPR and recovery positions for responsive patients. For example, I already told you if after giving compressions and proper airway, if the person became responsive, then what is the recovery position should be kept in? And rescue specific strategies, that is like if you are all comes under persons who are not related to medical profession, so you're having a separate chain of things to carry out, and foreign body area obstruction, so that we already discussed recently, and CPR additional information. Persons AHA chain of survival not related to medical profession, so you're having a separate out of the hospital cardiac patient. First of all, recognition and activation of emergency response. So I told you, when a person is unresponsive, try to wake him up and by giving a proper painful stimulus on the shoulders, and if he is not responding, check for carotid pulse along with simultaneously with the chest raise, and then if there is no carotid pulse with chest raise, then immediately call for help. That is called activation of emergency response on the shoulders. Then once you call for help, you have to start along with high quality CPR. What are the things which includes in high quality CPR? I'll mention it after this. And rapid defibrillation will be done likely that to do a rapid defibrillation is nothing but giving shock. Okay. If the patient is unshockable, for example, any feel like I want to my audio is clear, right? If the patient is unshockable, for
It is clear.
example,
It is clear.
any feel
Yeah, it is dragging a little sometimes, but overall it is clear.
Okay. Now,
It is clear. It is clear.
Aditya Saxena.
Yeah, it is dragging
Yes,
a
sir.
little sometimes, but
So,
overall it is clear.
did you see? I mean, Three Idiots
It is
movie.
clear. It is
Yes.
clear.
Aditya Saxena. Yes. Did you remember the starting scene of the
Yes, sir.
movie?
Sometimes, but
So,
overall it is
Uh,
clear.
yes,
did you
one of the
see?
character had pretended
I mean, yes. Three Idiots
It is
movie.
clear.
and there was some discharge from his mouth,
Yes.
and
Did you
he
remember the starting scene of the movie?
acted to faint.
Yes.
Yes, one of the
Such
character had
scenarios
pretended,
because in airports mostly because every public place has
and there was
now
some discharge
we are
from
going
his
to
mouth,
discuss about AED.
and he
It is called automated external
acted to
defibrillator.
faint.
Okay. So
Yes,
defibrillation is nothing but giving shock. Okay. So whenever our heart rhythm is improper and it is irregular, we'll call it as fibrillation. Okay. We are try to defibrillate with a defibrillator. Okay. In that movie, you can see once the patient becomes unresponsive, they'll try to call for immediate medical attention. So usually our airports, you can see whenever you travel through airway, you can check in the airports, there will be an attached AED on the walls of the airport. For example, if a person is unresponsive, what they'll do, they'll start the CPR. All the airport crew they know how to do CPR. They are trained in BLS. Immediately, if they call for help, what they'll do, they'll get an AED what they'll do, like they'll start the CPR, they'll get the AED and they'll attach it to the patient's chest. They are trained in BLS. So usually what we see, the shock giving in movies, so that shock will be given by the automated external defibrillator. So our in that scenario, our part is to do CPR and attach the AED to the patient's mouth. That will be taken care by some authorities in the area. So that is what I want to tell you. Thank you, Aditya. So whenever you are in any public place or like in sophisticated public places like in airports or in any proper shopping malls, so where we find that proper AEDs attached at one part of the mall or one part of the airport, so where immediately when any airport crew or any of the mall members or mall staff, if they got to know that patient is unresponsive, they'll get that AED. So once you got the AED, what you need to do is like the instructions are clearly written on the AED, like how to operate it. Okay. So that AED we cannot because of the limitations we cannot exactly make you learn how to operate the AED, but it's clearly written like how to operate on each AEDs. So we are not going to discuss that in today. So, but I want everyone to know that defibrillation will be done. Defibrillation is nothing but irregular rhythm of heart, and defibrillation will be done if the patient is having such rhythm in any cardiac arrest patient. Today, okay, thank you. So, but I want everyone to know that defibrillation
So,
will be done.
abnormal heartbeat,
Defibrillation
does
is
it
nothing
mean
but irregular
heartbeat
rhythm
more
of
than
heart,
the
and defibrillation will be done if
normal
the
range or
patient is
less
having
than
such
the
rhythm in any
normal
cardiac
range?
arrest patient. Today, okay, thank you. In any patient who is having cardiac arrest, there will be no heartbeat.
So,
Okay.
abnormal heartbeat, does it mean
Okay,
heartbeat
there will be
more
no
than
heartbeat,
the
but the heart rate will be repeated.
normal range or
But the
less
heart
than
rate will be
the
irregular.
normal range?
Heartbeat, you cannot find a heartbeat in that patient, but
So,
the AED
abnormal heartbeat,
will
does it mean
record the
heartbeat more
patient's
than
rhythm.
the
Okay,
normal range or less
got
than
it.
the
Because I
normal
want
range?
because whatever question you ask is a brilliant question. I just want to elaborate a little bit because what happens, for example, patient's rhythm. Okay, our heart will be pumping. You all know how the heart. For example, the heart will be pumped by the muscles surrounded by the heart.
When they contract and relax.
Yeah, heart muscles will try to contract and relax. For these muscles to get contract and relax, there will be one electric
When
node
they
which will
contract
supply
and
impulses
relax.
to the heart to give a regular contractions and regular relaxation. Okay, when patient is in cardiac arrest, sometimes what happens, this impulse which is coming, either it will be completely cut off or it will be giving an irregular impulses. But the heart won't function, but still the impulses will be there. These impulses will be recorded to AED. If the impulses are irregular, the AED will make sure the impulses are regular. If there is no impulse, then we need to do CPR only. So these
Okay.
impulses will be recorded to AED. So, but there will be no heartbeat. If the impulses are irregular,
Okay.
the AED got it right. So the impulses
Yes,
are
sir.
regular.
Thank
If
you.
there is no impulse, then we need to do CPR only. So these
Thank you.
impulses will be recorded to AED. So, but there will be no heartbeat. So rapid defibrillation that will be done to AED and the basic and advanced emergency medical services. So that will be done by the emergency experts by us. So your part is recognition and activation of emergency response system. If any person is not responding, you'll try to and the basic and advanced emergency. If is not responding, then try to check the carotid pulse simultaneously with the chest rise. Then you'll call for the help. Then that is called recognition and activation of emergency response system. Then you'll start the immediate CPR. That is to do compression rate with the rate of 100 to 120 beats per minute, and you take right. Then you'll call whether you're giving proper breaths, right? Checking the simultaneous chest rate. So this is the part you're going to do. So this recognition and activation of emergency response system and immediate high quality CPR is what you're going to do in basic life support. Rapid defibrillation will be done by AED, which will be this is which actually is a part of the particular public place which will be taken care by. And basic and advanced emergency medical services is by the emergency doctors and the complete health setup issue. Okay. So this is which actually we are trying to see what are the cardiopulmonary situations first. First, pre-CPR. What you do pre-CPR first, assess the scene safety. For example, if the any patient is having a cardiac arrest in a danger scene, I mean, for example, any terrorist attacks or any earthquakes or any fire accidents or any or any what we call floods or somewhere, make sure the scene is safe first of all, and next check for response by tapping on the shoulder and then then what will you do? Or any fire accidents or any assist movements, breathing and start compressions. What we call floods or somewhere, make sure the scene is safe first of all, and next check for response. So usually what happens, I already told you how to check the carotid pulse. So most of the people, it is very hard for them to identify because of the tense situation or because of the anxiety. They cannot appreciate the carotid pulse properly. So that is where what we try to do, we try to ask them to assess breathing movements. If there is proper chest space, you can all observe. If you now, because you are at home or some other place, just try to observe any person who is sleeping. For example, at your home, your father or mother or your brothers or anyone, if they are sleeping, just go and see their chest. So the chest will be simultaneously moved up and down, and in cardiac arrest patients you cannot see well. So that is where you start the compression. Because you are at home and how to open airway, to observe any person who is sleeping. For example, Nandakishore, your father or mother or your brothers or anyone, if they are sleeping, just go and see the Nandakishore. So the chest will be simultaneously moved up and down, and in cardiac arrest patients we cannot see well. So yeah, Nandakishore. So how to open airway? Already mentioned you. How to open airway? To observe any person who is sleeping. For example, Nandakishore, your father or mother or your brothers or anyone,
Sir,
if they are sleeping,
sorry, sir.
just
Can you
go and
repeat
see
it?
the Nandakishore. So how to open airway? I told you, like when you're giving airway, you need to make sure certain things.
Yes, sir.
So you are there, right, when I told. So how to open airway? Already mentioned you. How to open airway?
No, sir, I couldn't look at it.
You couldn't?
Sir, sorry, sir. Can you repeat it? Sir,
So
actually,
how to open airway? I
I
told
went to
you,
the work.
like when you're giving
I
airway, you
had
need to
some
make
work,
sure
so
certain
I
things.
missed the last
So
10 minutes.
you are there, right, when I told. So how to open airway? Already mentioned you.
Uh,
Okay. So
no, sir, I
so
couldn't
whenever the airway is, whenever
look
you're
at it.
giving a proper breathe to any person, so you
Sir,
make sure his head
sorry,
is
sir. Can you repeat it? Sir, actually,
tilted and chin
I went to
lifted,
the
and
work.
after that
I had
you
some
give
work,
proper
so
breath. That is how
I missed the last
you
10
make sure
minutes.
the airway is patent and there is no tongue fallback. So okay,
Sir,
so whenever the airway is, whenever you're giving a proper breath to any person, so you make sure
Yes,
his
sir.
head is. Yeah.
Sir,
Can you
actually,
explain me how to open
I
airway?
went to the work.
After that,
I had
you
some
give it
work,
proper
so
breath. That is how
I missed the last
you
10
make sure
minutes.
the airway is patent and there is no tongue fallback. So okay,
Sir,
so whenever the airway is, whenever you're giving a proper breath to any person, so you make sure
Yes,
his
sir.
head is. Yeah.
Sir,
Can you
actually,
explain me how to open? So what are the things we do to give proper breathing to an unresponsive patient? You make sure the airway is patent and there is no tongue fallback. So okay, so whenever the airway is, whenever you're
Bhavani,
giving
why
a
are you
proper
not
breath to any
responding?
person, so you make sure
Yes,
his
sir.
head is. Yeah. Can you
actually,
explain me how to open? So what are the things we do to give proper breathing to an unresponsive patient? You make sure the airway is patent. Okay, Dinkar. There is no tongue fallback.
yes, sir.
Okay. So whenever.
Sir,
So what?
Bhavani,
Yeah.
why
sir,
are
to
you
clear
not
the passage, we
responding?
need to first tilt the head of the patient upward in such a way that the chin is facing, we tilt the chin in upward direction so that the tongue moves out of the passage that is
Yes.
connecting the mouth to the lung.
Okay, Dinkar. Yeah.
And then
Very
we
nice.
start
Very.
giving. Yes, sir.
Yes, yes.
Sir,
Very nice. And once you
Bhavani, why are
start
to
you
giving
clear
not
the passage,
oxygen,
we
responding?
need
how
to
will you
first
know that the
tilt the head of the
patient got
patient
enough
upward in
oxygen?
such a way that the chin is facing tilt the chin in upward direction so that the chest moves out of the
Yes,
passage
by seeing the chest
that
raise.
disconnecting
Very
from
nice, very nice, Dinkar. Thank you.
Yeah.
and then we start giving.
Yes, this is how we open the airway and then administer rescue breaths. I already told you how to rescue, give a proper rescue breath, and
Chin is
use of
served by
AED
tilt the
as
chin
soon as
I'm
it's
not sure,
available.
but by seeing
Okay,
the chest
and
moves
I
out of
already
the passage
mentioned what is your role in this basic life support. Thank you. First,
and then we
you
start
have to diagnose that patient is having cardiac arrest by checking his response and assessing his breathing and checking by checking his pulse. If there is no, I mean, there is no carotid pulse and no simultaneous breaths, which is no simultaneous chest rise, then we need to immediately call support. I mean, we have to make sure that we inform the medical care or inform the healthcare system immediately, or the any person who is taking care of other things in the nearby. So after that, once you inform, you have to give proper compressions with proper oxygen through an open airway till we get the assistance. For example, if we are in any way close by, I mean, if we are in some place, rural place where there is no healthcare system, we try to do this CPR at least for 30 to 40 minutes, checking carotid pulse every 2 minutes, and if the patient is not responding, we'll terminate the efforts through an open airway. So pre-CPR steps, always make sure that the scene is safe and check for response. Shake gently or shout loudly and call for help. Ask for AED and alert code blue. Code blue is it's in hospital scenario. And if the patient is not responding, and how to assess? So assessment by non-healthcare professionals that I told you, we have to check whether any simultaneous, I mean, chest rise or not. Look, listen, and feel. So look whether there is any chest rise. Listen for the breathing and feel for carotid pulse. And how to assess? So usually, so I already mentioned you how to check carotid pulse. Whenever you're checking carotid pulse, we have to try to make sure that you have to check it for at least 5 to 10 minutes. Chest rise or not. Look, listen, and feel. So look whether there is any chest rise. So already you mentioned like I've seen the shown you positions of how to do CPR. So this is the position you need to be in, and 30 compressions, and the compressions should go at least depth of 2 inches. Now my question is, so look whether there is any chest rise. So already you mentioned like I've seen the question positions of how to do CPR. Chirag Maheshwari. So
Yes, sir.
this is the position you need to be in. So 30 compressions. May I know the compressions should go how many inches? Sorry, how many centimeters make 1 inch? My question. So look whether there is any chest rise. So already you mentioned like I've seen the
I'm not sure,
question
around two
positions
and
of how to
a
do
half.
CPR. Yes, Chirag Maheshwari. So 2.5 centimeters. So that is nothing but 5 centimeters. You need to go the depth. So whenever you're compressing, you should not go more than 5 centimeters depth. That is 2 inches. So you need to be make sure that the depth at which you're compressing the patient's chest should not be more
I'm
than
not sure,
5
around two
centimeters.
and
And the rate at which you're compressing should be 100 to 120 per minute. So for example, if you're giving compressions like per minute you're giving 60 compressions, that is not adequate to make the patient so you need to be to make the patient revive. So the compression rate at which we need to give is like 100 to 120 per minute. And whenever you're giving compressions, make sure the chest recoils. So once you go for a depth of 5 centimeters, you have to make sure the chest completely recoils. That is like the chest comes to normal position, then we need to compress. So this is how to make the patient need to minimize interruptions in compression. For example, if you're going giving interruptions and someone wants to make sure what is the patient condition, you should not stop the compression for a depth of 5 centimeters. You should do it simultaneously. Whenever you're calling for help, also make sure you tell it to some other person and start. I mean,
do the compressions without any interruptions. Interruptions make it incomplete flow, so that the patient chances of revival will decline. To make sure what is the patient condition, you should not stop the compression for a depth of 5 minutes. So I already open the airway, head tilt and chin lift. So this is for healthcare professionals. What you need to make sure in person chin lift to come into the compressions without any interruptions. How will check the breathing? Whether there is any proper chest raise or not. So to give two rescue breaths, you can see the image how the person in the image gives proper breathe to the person. She with one hand she tilted the head, and with the other two fingers of the other hand she gave proper lift. And after that you can use a barrier device if possible, or else so what happens whenever you're giving thing, I forgot to mention, you have to close the nose. You have to pinch the nose, because otherwise if you give breath it will come out through the nose. So pinch the person's nose, take it normal breath by yourself, and cover the person's mouth with yours and making a seal. Go with enough volume until the chest rises. You can use take it for 1 second, allow chest to fall. That is like allow chest to be in the normal position and give one more breath. Like this is like after every 30 compressions we need to give two rescue breaths. So using AED, take it normal by yourself. So these AEDs will be in the malls and airports and all the sophisticated modern airport places, where you can see first of all when you see the AED, switch the power button. Always switch the power button on, and after that the AED will give you command. So the next command, once the switch the power button on, the AED will ask you to attach the pads on the victim's brain. And airports and all the commanded modern. So after that, analyzing the rhythm. When you analyzing the rhythm, no one should give compression. Switch the power button. If you are giving compression at a different point of time, the rhythm will be different. So the AED will analyze the rhythm. During that, do not touch the patient. And after that, when the patient has to attach the pads on the defibrillation. That is nothing but when the patient is having fibrillation, it is irregular rhythm. The AED will try to defibrillate. This is called giving a shock, and this giving to give that shock. When the AED is giving the shock, everyone has to be out of it. So we have to make sure that no one is touching the patient, because the shock is of a proper joule, so that it is close to 360 joules. It will affect our body as well. That is why whenever the AED is giving shock, make sure they are clear to the patient. And once the shock is done, again start giving that out of it. So always whenever you are using AED, the first step to start with the AED is like power the you should switch the power button on, and after that the AED will ask you to attach the paddle to the patient chest. You can see one chest under exactly on the paddle there will be clearly mentioned where to attach the paddles as well. And after that, once you attach the paddles, the ECG will the AED will analyze the rhythm. And after that, if the shock has to be given, it will ask you to make sure you're clear. And once that is done, then you should start the compression followed by two rests. The paddle the patient chest. You can see one chest after every 2 minutes. Once that is done, after 2 minutes, stop the compression and recheck the paddles. And after that, I told you the recovery position. For example, after the AED, you can see the patient is having pulse. And after that, if the shock has to be given, it will ask patient is having pulse. And once that thing you need to reach the recovery position, you should lift his right hand up. Always make sure that put the patient on the left side. I'll tell you the reasons why we need to put him on such position. First, you raise the right hand up. I told you the recovery position. Then after that, you can see the left hand has to go below his chin. He's having pulse. And once that thing you need to then you need to make sure the left leg is folded or put the patient on the left side. I'll tell you the reasons why we need to put him on such position. First, you raise the the right side. So you can do the same to the left side as well. I'll tell you the reasons why he was placed in such position. First thing is like to make sure the left leg, then you need to make sure the left leg is folded or like this side to make sure that to make sure that the patient is on a lying position where he cannot be rolled either prone or supine position. So that's why his leg has the weight restraint. He was kept on the opposite side, and after that, hand was kept below his chin or below his cheek to make sure that even though if he vomits, the patient is on a lying position where he cannot be rolled either re-aspirated into so that's why his leg has the weight we call into his lungs. After that, hand was kept to make sure his so ask below his cheek. Anyone got any doubts with that? Even though he vomits, the patient is Abhinav Anand.
Sir, voice was not clear. Could you please repeat this once more?
So your voice was breaking.
Yes, lungs. Now this is so ask below his cheek.
Still
Got
breaking.
any doubts with that? Okay, give me one second. Abhinav Anand.
Sir, voice was not clear. Could you please repeat this once more?
So your voice was breaking.
Yes, lungs. Now this is so ask below his cheek.
Still
Got
breaking.
any doubts with that? Okay, give me one second. What about now?
Yes, sir, it is better now.
Okay. So Aditya Anand, Abhinav Anand, sorry.
Yes, sir.
Have you seen any person vomiting after? I mean, you have seen any of your friends drinking and after that he's puking?
Yes, sir.
Okay. So what happens if an alcoholic person pukes? So what happens is like any person, if I am conscious, so I'll try to vomit it out. So without aspirating it into my lungs. For example, if an unconscious person, if he try to vomit, what happens? If unconscious person won't try to vomit. So sometimes because of the gastric irritation, the food contents in the stomach, they'll come out into the esophagus and after that into the mouth. And after that it will stay in the mouth and pharynx. And when taking deep breaths, the vomit which is present in the pharynx, it will go into the lungs. So that will cause lung infection. That is called aspiration pneumonia. This will happen in any patients who are unresponsive, who are like 70 to 80-year-old, who are bedridden, and any patient who had alcohol, and after that their cognitive senses will be low and their body control will be very low. In such scenarios, will happen. The food which is present in the pharynx will try to go into the lungs when he's taking the breaths. So to avoid it, we'll try to position him in the left side or right side anyway. So when you position him that way, so what happens if any food it is in the mouth or in the pharynx, it will try to come out obviously without going
into the lungs. So that is why we are putting the position in recovery position. So this is what you need to do here. So and so these are the strategies of CPR. For example, if you are not so confident about giving a rescue breath, always try to give chest compressions. So don't waste your time to give rescue breaths if you are not so confident about it. If you are not trained also, just try to use that hand compressions properly. If you're confident about giving rescue breaths, you can give it. Okay.
Hello, Bombay. Hello, Viskumai.
Now the second topic for today, I want to make sure whether anyone have any doubts in this BLS session. Now, if you want to ask me any questions or something, just go with that, and after that we'll go to a small topic after this. Okay. I know at time we got like 40 more minutes for the end of this session. So we'll take 5 to 10 minutes for your questions. If you have any questions, go with that. And if you don't have, we'll try to move on to the next topic. And one more thing, be interactive. I am not any person who's going to judge you with your questions. I'm very open. If it is a small thing also, be open with that. You got any scenarios in your life, any interesting topics to be shared, anything. Any questions or any doubts you have previously with any such kind of medical conditions you or your family members had experienced previously, please go with those questions. I'm okay to answer. No questions?
So how to stop blood flow or administer first aid in case if there's uh, damage in the vein or something when the blood starts coming out very quick.
Yeah. So I have that session in the next topic, but I just have a small thing about it. Actually, what happens whenever you're having any bleeding. So whenever any person having any bleeding in during any trauma at home or any accidents, first what you need to do, put any dry cloth on the bleeding side and put as much pressure as you can. Okay. There are like two kinds of vessels in our body. One is artery, one is vein. When the wound side, when the blood is coming from vein, the bleeding will be very less. When the blood is coming from artery, the bleeding will be very more because artery is directed directly from the vein is the one thing which takes blood from body to the heart. So artery is the from the body. So arteries will be always deep. But during some accidents, for example, there are some arteries in the temporal region which are very superficial. So they got punctured. So the blood will spill out like a flower pot. So it will spill continuously. So we need to do one thing. First thing, always when you're giving first aid, the first thing you need to maintain is confidence. You have to be very confident because whatever you're trying to do is the person who goes for first aid, he always thinks of one thing. he don't know whether he is doing it properly or not properly, but he want to help the patient. So that is what the main motto which is pushing him to do such things. So then what he'll do, so what we'll do, one thing we need to do, put proper pressure with a dry cloth. Some people you can see at home they apply turmeric. That is not a bad thing. You can apply turmeric also. But while when you come to hospital, it will take a lot of time to clean the turmeric. So, but it's not a bad thing. So always apply pressure with a dry cloth on the wound side. If the bleeding is so severe, don't worry about it. If the bleeding is so severe, still you need to put lot of pressure. So but don't put cotton. Okay, small amount of cotton, big amount of cotton. Cotton, what cotton does is like it will absorb blood. It will absorb blood. So that is why always don't go with what we call normal I mean cotton which is present at home. So because cotton absorbs lots and lot of fluid, so always go with normal cloths. Normal cloths, putting some what we call if for example if any wound happens on the leg, try to put a pillow on the leg. And not, I mean, for example, if it is bleeding, if it is a fracture, don't I mean put too much pressure on that.
Yes, sir.
Thank you.
So what if there's uh, like skin has torn and stitches are required in that case? Then
For
also
that
we
case
have to
also,
only cover with cloth.
yes, same thing.
Okay.
So your main motto in that scenario is you're trying to stop the bleeding. So that is that will come under first aid. So suturing it will come under the expert scenario. So we'll do the suturing and stuff. So whatever you're trying to do is just to stop the bleeding at that point of time. So to you just need to cover it a proper pure, I mean, which is like a hygienic cloth, which we use like towels at home, which were
Hmm.
washed properly. So you use that at home. If you're at somewhere outside or road traffic accident or something, where you can use, I mean, if there is some cloth available, not the one which is dirty, normal proper cloth, and after that you apply pressure to make sure the bleeding stops.
So
Okay.
actually,
Even
one
if
of
the bleeding continues, just make sure you give a proper pressure. That's it.
okay. So actually, this had happened before once. One of my friend. So we
Oh,
had gathered cloths and we had just wrapped it around his hand and taken him to the hospital. So that's why we were think. I was thinking whether it was the right thing or we could have done something else.
no, 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 no. First, yeah, whatever you did was the right thing.
Okay.
Any more questions? Any more questions from anyone? Thank you, Aditya, for the wonderful question. I've been.
I have a question. So, after the hernia surgery, sometimes what happens that the surgery opens from inside and it causes hernia again. So,
Okay.
what happens? A person who works with that condition suddenly faces pain. So, how to relax or how to make the person relax in such conditions?
In such scenarios, first of all, the patient who has that recurrent hernia, he'll have the pain initially. Okay.
Okay. Yeah.
And second thing, when the person is having such kind of issue, first thing, the only reason for that is because the patient, whatever, there is a loose gap in his abdomen, which will cause that hernia to penetrate into the testicles of the patient, scrotum or testicles or the inguinal region. So even though that is not an what we call this emergency situation or any situation which will make the patient lose his life. Okay. In such scenarios, for example, any person having a hernia surgery, he need to take proper rest for a long time. He need to be very careful with his abdomen and with his walking or with his running or with his daily activity to make sure that he gives enough rest to for the abdomen to recover completely so that no gap is present. For again, hernia is nothing but the intestinal contents will go, that is what our small intestine or large intestine will go into the inguinal, will go into the inguinal canal through a small gap between them. So we need to give proper rest to recover. That's it. And even though if hernia recurs, there is nothing to worry. Most of the hernia, very, very, very small portion of hernias are having poor prognosis. Otherwise, rest of the things are common, normal. Okay, Abhinav?
Thank you, sir.
Hmm. So, may I go into the next topic of mine?
Oh, sir, I had a question.
Yes. Yes,
So,
Simran.
if we twist our hand or our ankle, should we apply heat or ice?
Always for pain, apply ice.
Okay, sir.
Facts are the only things which will relieve from pain, not anything which is heat. Okay?
Oh, yes, sir. Thank you.
Yeah.
Okay.
So even I have a one question.
Yes.
So for if there is a mild burn or something, what will be the immediate steps that we should perform?
Super question, Sivaj. So whenever any person is having a burn, so first always, if the burn is so severe, okay, so always we need to cover the burn area with the hygienic cloth. If there is new cloth which is available at your home, first of all, put water on the burnt area, clean it properly, not so roughly. You should be very gentle when you're cleaning a burnt part. Clean it properly because sometimes what happens there will be a chemical something or any burnt part or any burning cloth or thing which will remain on the skin. So you need to clean it with proper cool gentle water, and after that apply a pure and hygienic cloth on that and take the patient to the hospital immediately. So if the burn area is very minute, you can make sure that you can take care of it at home. But if it is a large one, for example, during Diwali or some, like I have seen some patients when they are doing pujas at home. I have seen a 80-year-old, 65-year-old female who was doing harati at home. She was doing harati at home. Suddenly, that camphor it came on face. So before because 65-year-old, she was unable to immediately drape off the sari. So both her legs from the bottom of the leg to fully burned. So immediately, what happened? There is one person who is not a doctor. He's just some person who had some skills in first aid. What he did, he got a fresh cloths. He soaked it in water, ice water, and he applied from top of the groin to the foot. And he brought the patient under a clean sheet of bed sheet, and he brought to the hospital. Whatever, when we see the patient at the hospital, even though the pain, even though it was very severe pain, just because her whole legs are burnt, pain being a 65-year-old, just because the application which the patient attender who did at home, it was brilliant. So because of the ice water application, the pain is very soothing. So there was no such pain. And even though it was fully burnt, because of the application of proper hygienic cloth, there was not much. That is what we can do it at homes when we see such scenarios of burns. Thank you.
Thank you so much, sir.
So one more question.
Yes.
So if somebody has drowned and we have just taken him out of water, so should we make him lay on his stomach or back to pump out the?
Sorry, I didn't get you. When somebody is drunk,
Not drunk, drowned. Drowned.
drowned in
Hmm.
water.
Yes.
Yes. So when somebody is drowned, what is the next?
Should we make him lay on his stomach or on
No,
his
no,
back?
I'm asking you a question, Aditya.
Hmm.
I'm asking you a question. Somebody is drowned. It is an emergency situation. What is the next step to do?
So first to pump out the water and check the pulse. Check the pulse first.
Yeah. First, check for response.
Yes, sir.
whether patient is responding. If
So
patient
sorry,
is
your voice is
responding,
breaking.
I think we already have seen people. Sorry,
Your voice is breaking in between.
now okay. Is it okay now?
Yes, sir. Now it is okay.
Okay, when the patient is drowned, I think we have seen people doing what we call this abdominal thrust to make sure his water comes out directly. Is that what you did? People have seen, right?
Yes,
Ajit,
sir.
yeah, my voice is audible, right?
So actually, it is
So
breaking in between. So I don't know if I'm only facing this issue or if others are also not able to hear you correctly.
because is it clear now?
No, sir.
No?
Yes, sir.
Yeah. So I think we all have seen in movies that whenever a patient is drowned in water, the first thing they'll do is like they'll drag the patient out of the water, and after that they'll give some abdominal thrust so that he'll get the water out of his body. This is what we actually in movies are have experienced such scenarios. But what is like if someone drank a lot of water, will that affect his body?
No, sir.
But why they want to push water out?
So maybe because the water must have gone through his nose also.
Yes, yes. Even though if it goes through his nose also, some water they think that they expect the water to go into his lungs.
Yes, sir.
They want to get that water out of their lungs. So if the person is not responding, then what is the next step to do?
Uh, Perform CPR. First, check whether
Yeah,
there is no
check
blockage
for
or not.
pulse. Yeah, check for pulse. See for chest raise. If there is no chest raise and no pulse, then what will you do? Start CPR. Okay. And if
Yes,
the
sir.
patient is responding and he's talking, there is nothing to do. So just make sure he was wrapped in a proper warm clothes, and he'll be kept on the left lateral position, like how we have kept the patient in recovery position. And after that, we'll take him to the hospital to check whether he has any such kind of if he ingested any what we call chemical water or something, it has to be treated. So that's why we'll take him to hospital. So even though if he's drowned, the things we'll do is like if he's responsive, we'll take him to hospital by draping him in proper dry clothes and or in dupatta or something. Or if he's unconscious or unresponsive, we'll start the CPR immediately. Okay, and if you want to put any person in any position, I think you all are aware of people having fits, right? Seizures. Have
No, sir.
you? I think you have experienced fits patients. Like you have seen in movies that people they'll put some keys, iron or something in the hand. Yes, right.
No, sir. I have not seen actually.
No, fits is nothing but patients of epilepsy.
So,
So
do you
what
mean
I'm
Caesars?
Aditya.
Like they, like Caesars, they get uh, they're completely still, something like that. I actually don't know.
Yeah, it's okay. It's okay, Aditya. So what we do? So any patient always when you're taking him when you're taking him who is unresponsive patient, try to put him in recovery position. That is, either left side or right side, with one hand flexed and put on the opposite side. With one leg flexed and put kept on opposite side, and one hand below his chin or cheek. Okay.
Hmm.
So that's a position to take any person to a hospital who is unresponsive and recover.
Okay.
Hmm.
Thank you, sir.
Yeah. Any other questions? Yes, Shravani, Shravani Tia.
Hello, sir.
Hi,
Hello.
Shravani.
Hello,
Yes.
sir. Sir, after the impaction, surgical extraction, usually patient have a swelling and pain. So in that case, we usually advise a cold pack. As you have said that in case of pain, we usually apply the heat.
I didn't get you. Your voice is not clear, Shravani.
Hello, sir.
Yes, yes.
Sir, after the impaction, usually patient have a swelling and the pain.
After the
He- Hello, sir.
yes,
Hello.
your voice is dragging. It's not clear.
Oh, sir, can I type the question then?
Yes, yes,
Hello.
yes. Go on, go on. Type the question.
Okay, sir.
Something is going on.
Meanwhile, can I ask a question?
Yes, yes, ma'am. You're welcome to ask a question. Yes, go on, ma'am.
I don't know what happened.
Yes, go on,
Can I?
ma'am.
Yeah, so is hypoglycemia an emergency condition?
Yes, hypoglycemia is a major emergency condition. So any person who's having hypoglycemia, most of the people people who are on insulin, diabetic people who are on insulin, so they
Hmm.
usually experience this hypoglycemia. So what they should make sure that they always carry a glycometer. Glycometer is the one thing which we use to check the sugars, right? So what we used to do whenever any person who's having a hypoglycemia, we'll check the pulse, and if there is pulse is there and the patient is not responding, we'll check the glucose levels. And if the glucose levels are less than 70, then immediately what we need to do, we'll use the sugar, put it under the tongue at home. If he is anywhere nearby hospital, you'll take him to the hospital immediately. You have to put him something which is sugar under his tongue. So it will immediately elevate the sugars and the patient will come to consciousness.
Okay. Okay. Thank you.
Yeah.
Thank you.
Yes. Yeah. Question from Shravani. After impaction, okay, patient have swelling and pain. In that case, we usually advise them cold pack, as they have said in general that heat is applied in case of pain. So after any kind of injury, like any fracture and anything, when the patient, if he is in hospital, he'll be treated with an analgesics. But he want to be at home, we always advise them to give an ice pack application to relieve the pain, because the ice pack, whatever ice, it will numb the pain receptors at the particular area, so that the pain which the patient is already experiencing, which will decrease. So that is why we always ask patients to apply ice packs and not any heat. Shravani, I didn't tell that we apply heat. We only apply cold packs. That is what ice packs. We never apply heat in case of pain. So maybe I think you have misunderstood. I think. Abhinav Anand. Go on,
So,
Abhinav.
yeah, sir, sometimes we face a condition that like we don't have meds for a fever, and a person gets a fever at like midnight or something. So, in that condition, how to like uh, take care of the patient till the morning so that we could get medicine for that.
Yeah, nice question, Abhinav. Actually, what happens if a person's temperature is more than normal, it's not at all an issue, first of all. But what is the issue there is like patient's weakness. The patient feel very weak, and he'll feel headache, and that weakness has to be treated. To treat that weakness, what we need to do is first always make sure the patient is having proper amount of fluids. For example, I'm a person who had COVID, so I got infected with COVID. I think you all know like how COVID people got weakness and everything. Maybe you had that experience of COVID yourself, but I didn't had any weakness. Even though I was having COVID, I had a severe COVID. Severe COVID is nothing but I have breathing issues and everything, but I never had weakness just because I drink 4 liters of water every day. So because I'm drinking proper amount of water, I'm urinating proper white urine, so I never had issues. So whenever you're having any person who's having fever at midnights, and if you don't have any medical assistant, and if you want to take care of him, so first thing you need to make sure is like make sure he drinks proper amount of water, that is at least 2 glasses every 1 hour. And next thing you apply in what we call this tepid sponging. Tepid sponging is nothing but just take some water, take some water and boil them to very warm things. Like just warm the water, and after that, just use the cloth and put it in the water, and after that apply on the patient's body. It immediately relieves the patient's temperatures to normal thing. So that is what we do when the patient is having temperature and generalized weakness. We treat the weakness with water. So even though if you go to hospital, what they'll do for the temperature raise, they'll give antipyretics, that is called paracetamol. They'll give that will maintain the temperature normal, and the patient is weak, they'll give IV fluids. IV fluids is just because IV fluids will rapidly increase the patient's conditions. If he can take water at least 2 glasses per hour when he's having fever, at least by 2 to 3 hours, the patient will recover completely. So that is what we can do when the patient is having no medical assistance nearby and if he's having fever at night. Okay. So two things we need to do. One is tepid sponging. Sponging is nothing but putting some cloth in very warm water, and after that applying it on the whole body for at least 5 to 10 minutes. So and for to relieve the generalized weakness, we'll ask him to drink as in more and more water. If you can add some sugar, you can add some honey, and you can add some lemon also. That will make sure the patient gets enough electrolyte requirements also. Thank you.
Thank you, sir.
So now we'll go with the next topic. It's a very small topic, but it's important as well. So let's see it here. So I already mentioned what is disaster. So disaster is a sudden ecological phenomena of sufficient magnitude to require external assistance. Usually, what happens if a person, if any person, for example, if he's at home, he is walking to washroom from his bedroom. Suddenly, he got hit to the chair, which is just inside his bedroom, and he got a little bleeding on the leg. So that may not require an external assistance to him. He can be just taken to hospital by himself. That is not a disaster. So what disasters are something where number of patients like more than 10, more than 5 or more than 10, like multiple number of patients got medical issues because of a single external cause or an internal cause. Now you can see COVID is a disaster. COVID is a disaster because multiple people, not even one, like numbers of people got infected. and they came to hospital, they need medical assistance. Earthquake is one kind of disaster. Road traffic accidents like buses, if you can see a 45 or 50 member people traveling in a bus got met with an accident, then that is called a disaster, because at one point of time we need a hospital which will treat at a point like 50 patients. So no hospital has 50 doctors to treat 50 patients. In such scenario, 50 patients, all the patients needs equal attention, and it is nearly impossible to one doctor or two doctor to provide support to 50 patients at a time. So that we call it as disaster, or any earthquake, or any floods, or any terrorist attacks, or any bomb blasts. These are all comes under disaster. In such scenarios, for example, for example, if you take your what we call, for example, if you are in a park, or if you are in a area, so for example, you attended a meeting. So somewhere nearby, what happens during the meeting, there was some unexpected thing, and there is some construction default. There was a like fall of a roof or something that lead to injury to multiple people, and all need medical assistance. But you have to make sure which people has to be treated priorly, because for example, a person who's having a little finger fracture and one person is having a head injury, is both the patients got suffered with the same incident, but the patient who's having a head injury needs medical attention importantly than the patient who's having a little finger injury. So that is what you have to learn in a public domain or in a society, where because we are living in a society, every person has to help the other person to have a proper goal. So that is why I want you guys to learn about proper triage. Triage is nothing but prioritizing the patient, prioritizing the patient for better medical assistance. So in disaster situations, how to triage a patient properly. For example, I'll tell you one thing. So any patient, for example, there was one patient, there are like number of patients in a disaster. Let's seem like there is a bomb blast in nearby parks, okay, or in an airport or a train, something. So you are just crossing, you are one person who's traveling nearby, and you found that there was a bomb blast nearby, and you ran to the site, and you saw a number of people just lying down on the road or lying down on the area. So you want to help them. So how you will help them? First thing, what you need to do, you need to check which people you should help. You have a car yourself, you want to take some people to the hospital. Which of the people you want to take to the hospital? I'll try to explain. Whenever there is a disaster, there will be four categories of people. First category of people who needs immediate medical attention. They want to be treated immediately so that their life will be saved. And second thing, they can be delayed for at least half an hour to 1 hour. So after 1 hour also they can be treated. Third thing is like they can be taken care to hospital a day after or 2 days after. That's not a big worry. Just like a small finger swelling or a hand swelling or something. That will not make him lose his life. That is the third category. And fourth category is already dead. When the patient is already dead, we can do nothing. Okay, and I know all of the guys, like all of you guys, know how to make sure the patient is having a cardiac arrest or he is not responsive. You already know how to do. You'll check the response, and if there is no response, then what we'll do? We'll check the respiration simultaneously, and there is no chest rise, then we'll try to call for help in normal scenarios. But in disasters, what will you do when there is no response and there is no chest raise, no cardiac pulse? Leave the patient aside. No need to hold the patient. Okay. And the next thing, always the priority one patients. There will be three priorities. Priority one, that is marked by red. Priority two, that is marked by yellow. Priority three, that is marked by green. You all should aware of this. So in priority red, so that is immediate attention patients. So you can see the triage chart on your screen. So whenever a patient comes, you need to check the respiration of the patient. If the respiration is, there is no respiration, there is no chest rise, position airway, head tilt, chin lift you'll do. And after that, if the patient is having breathing by himself after head tilt, chin lift, then put him as red category. You need to take him to the hospital immediately. And after putting the airway also, if he is not
breathing, then he is unsalvageable. So he has to be kept there. He needs no attention at that point of time, because we want to treat patients who, if you help, they can survive. So that is what our main motto is. So we'll check the respiration by seeing the chest rise and listening to the breathing, and if there is no chest rise and there is no breathing, position the airway, and if there is no breathing after that also, put the patient aside. And if there is breathing, take him to your car and take to hospital. And if the respirations are there, the patient on the immediate on the once you assess the patient, when you're seeing the patient, if there is any breathing, see whether he is having high breath rate or he is having low breath rate. Low breath rate is nothing but less than 30, like how we breathe. Our normal breath rate is 18 to 22. Okay, if it is like between 18 to 22 or 25, then if it is more than 30, then what we do, patient needs immediate attention, go take him to hospital immediately. If there is no if the heart rate is very, I mean, if the breath rate is normal, then what we need to do, I told you carotid pulse, now we have to check radial pulse. Radial pulse is the peripheral pulse which we check in hands. So if there is pulse, we need to check the mental status, whether he is following commands or he is not following commands. You can see the chart here. So I just want to make you very clear that whenever in any disaster situation, if the patient is walking, if the sufferer is walking, so he can be taken to hospital lately. So he don't need an immediate attention. So put him aside. So person who is what we call, who is completely lied down and there is no chest rise, and you open the airway, still no chest rise, then put him away. These two patients don't need any care immediately. So because one is dead and one, he can go to hospital on his own. So these two patients won't come for, uh, you don't need to help them immediately. So people, you need to help them. One, the person who's having respiratory rate more than 30, so then he needs immediate attention. And if the respiratory rate is normal, we'll check the radial pulse, and radial pulse is less. Why the radial pulse is less? Just because if there is any bleeding wounds, if the blood is losing completely, then what will you do? As per the protocol, you will try to get a cloth, apply pressure on the bleeding side, and take him to hospital. If the radial pulse is also normal and he is telling answers for your questions, if you ask like whether you are okay, he tell yeah, I'm okay and fine, then you can take him to hospital later. If it's not responding, but if you're asking something and is questioning other thing, if you answering questioning something and answering, I mean inappropriately, then he needs immediate attention also. So I want to make you clear. One thing is like any patient in the disaster scenario, we need to prioritize into four categories. One is red, who needs an immediate attention, and one is one is yellow, who needs attention at least in next 1 hour, and one is green. So patients who are walking, uh, all the patients who are walking, they come under green, and all the patients who are not responding and there is no chest raise, they come under black. So these are the four criteria. So green and black, you are not going to give an immediate help to them. So the red and yellow, they all come under immediate criteria. So what we do, so you'll check the respiration, and there is respiratory rate more than 30, then you need to take them to hospital immediately. Respiratory rate normal and there is severe bleeding in their body, then you need to take them to hospital immediately. And there is no bleeding and respiratory rate is normal, but the response is poor. Response matlab, like when you ask them a question, they are answering very lately or they are unable to answer, then the mental status is poor, they need an immediate attention. This is how you triage a patient in disaster. So coming to next, we'll talk about chest pain and stroke. So I'll tell you, I want everyone to know what we need to do in any patient who's having a chest pain. I'll tell you, this is very clear. In our emergency department, we have seen number of people dying of chest pain because of the late presentation to hospital, just because
every Indian, 90% of the Indians suggest any chest pain. Even they don't ask the people to go to hospital. They'll tell one thing, just because of the gas issues, you're having this kind of chest pain, try to take Eno. Eno is one ad which spoiled every Indian. Don't ever try it. For example, your fathers, your brothers, or any of your relatives, if they're having chest pain, first thing they need to do, even though it is a gas pain, ask them to go to hospital at the earliest. At one point, if they got chest pain, the next moment, in next half an hour, they should be nearest hospital where ECG can be taken. So that has to be taken care. Otherwise, you lose the patient. I told you the scenario where a 50-year-old man, he got chest pain and he was not recognized properly by the attendants. He did not survive. He lost his life yesterday. So make sure whenever any chest pain, even though it is gastritis, make sure he has to be taken to the hospital immediately. And how we categorize the chest pains. Chest pain because of the angina. Angina is nothing but pain to heart. So how the angina will present? Any patient who's having chest pain, usually what happens? Heart pain always aggravates on doing work. For example, if I am having a heart pain, if I walk for at least like 5 minutes, I'll get the pain aggravation. And if I take rest, it will be relieved, and it will be throwing like some, and it will be radiating always. Most of the pains, what happens, it will radiate to neck. Don't think if someone is complaining of a 50-year-old asking that, telling that he's having neck pain, don't take it light. You have to take him to hospital immediately. If it is radiating to shoulder, if it is radiating to back, so these are all the signs. So one thing is like chest pain radiating to shoulder, neck, or back has to be taken care immediately. And if he's having aggravating pain on walking, he has to be taken. And if the pain relieves on rest, then also these three categories, these three things has to be in your mind. When these three things are present, the patient is sure that he's having a chest pain, he's having a heart pain. So he has to get the hospital or cardiac attention immediately. So he need to be taken care within minutes to the hospital. Second comes the pleurisy. Pleurisy is nothing but lungs pain. How the lungs pain will come? I think most of the people, I think there are some people who got COVID. I think you have that experience. Whenever there is a lung pain, how it will go? When you take deep breath, the pain will increase. So this is how you differentiate lung pain with the heart pain. If you're taking deep breath and the pain is increasing, then immediately he need to be taken care to hospital for lung intervention. So whatever the chest pain, you need to take the hospital patient to hospital. But I am making sure that you know these kind of differentiation of different kinds of chest pain, so that you will be taking and giving an expert advice to some person who is completely lame. So if the patient is having pain or aggravating pain on deep breath, if the pain on taking a deep breath, if it is aggravating, then it completely of a pleuritic pain, but still he needs an hospital or doctor advice. Next comes esophageal pathology. For example, you had an alcohol day before, or you had a spicy food, or you have taken outside food or something, and after that you're having bloating in the abdomen with vomitings, or you're having a severe burning sensation at the center of the chest from neck to the abdomen, then it need to be taken care immediately. It has to be taken to a hospital. All, and chest trauma, any person who's traveling on a bike, or any person who's playing or something, suddenly he got injury to his chest, so he need to be taken care to a hospital, just because ribs in the chest might get fractured and they lead to puncturing of lungs. So always, any kind of chest pain, irrespective of what it may be, it need to be attended to the hospital at the earliest. So that is what I want to mention. So coming to next, we'll go stroke. I think everyone know what is stroke. Stroke is nothing but paralysis. In our Indian words, we call it as paralysis. So how paralysis happens? Usually paralysis happens, for example, in our brain there will be two hemispheres. Uh, if one hemisphere in one hemisphere, if for example if there is any blockage or blood circulation damage, then what happens? If it is left hemisphere, the right side will go. If it is right hemisphere, the left side will won't work. So how to what are the things to be taken care? For example, usually stroke happens in patients who are chronic smokers, who drink a lot, and who are having hypertension and diabetes. and whose age is more than 45 years. In such scenarios, what is the exact thing you need to recommend to such patients? For example, how to check whether the patient is having stroke? uh, Everyone can see me, right? So for example, any person who is having stroke, you need to do one thing. You need to check whether he's having stroke or he's not having stroke. First thing you'll ask him to do, you'll ask him to clench his teeth. If one side of the cheek, if it is not deviating and if it is straight and other side is deviating like this, then this side of the face is got paralysis. So first thing what you'll ask you to do, you'll ask you to clench the teeth, so that if the left side is paralyzed, so this this won't move, leading to deviation towards the right side. And second thing, you will ask them to put the hands up, close their eyes and put the hands up, close their eyes and put the hands up and count 10. If one side of the hand is falling down, then that means the patient is having paralysis on that side. And third thing is they will be having a slurred speech. If they have a slurred speech is like they cannot be able to complete a sentence. In these three scenarios, you have to check this in these scenarios. Sorry. So this is called fast. One is facial droop, that is you will check the face. Second is arm drift. You'll ask them to lift the both arms, closing their eyes, and if one hand falls between below this 10 seconds, then you can tell that the patient is having weakness on that side. And abnormal speech, if the patient is unable to repeat the sentence which you ask them to repeat, then that is called abnormal speech. If patient is having any of these three, immediately the patient has to be taken to the hospital. If the patient has if you take the patient after 4 hours of this presentation, it is very highly unlikely to get him back to normal condition. If he was taken before 4 hours, for example at 5 o'clock, if you have these symptoms, if you take him at 5:30, then the chances of getting him normal are very high. So these are the things: the paralysis and the chest pain has to be given immediate attention at your home. And coming to road traffic accidents, when a person met with a road traffic accident, if you're going passing the, I mean, you just passed by the road traffic accident, any person had that, then after that, if you want to help him, what you want to check, first thing is like, always, if the patient is responding, first thing you need to check whether his mental status. So his mental status, already mentioned in the disaster triage. So we'll check the respiratory rate more than 30 or something. But at that point of time, if you want to help the patient, so if you cannot take him to the hospital, but you want to help the patient, for example, his mental status is poor, he's not responding properly, then ask him to take to the hospital immediately. And if there is any bleeding site, if you want to help him, then what you need to do, cover the bleeding site and apply the pressure so that you stop the bleeding. And if there are any fractures, so fractures, how will you know the fractures? The leg movements will not be there. If the hand is fractured, hand movements will not be there, and patient will be complaining of severe pain. And sometimes some fractures will lead to bleeding also. At that point, what you need to do, you can just find any stick or something and just tie that stick to the hand. For example, if you got a hand fracture, so if you got a hand fracture, just place the bar or a stick parallel to the hand and just tie it with loosely, not very tightly. Or sometimes, usually people, what they do in rural setups, they'll use cardboards. They'll use cardboards, normal cardboards, and they'll cut the cardboard in the shape of the hand and they'll just tie it so that the hand will be immobilized. So whenever you want to help any patient who's having a road traffic accident, always, if there is any bleeding sites, apply proper pressure and apply proper pressure and cover the wound. And if you feel that patient is having fracture, he is complaining of severe pain on any leg or any hand, what you need to do, you need to put some support like any wooden stick or something, or any cardboard, and wrap with a cloth or wrap with a normal thread or something, so that it will help to immobilize the joint. So that is what you can do in any persons who's having road traffic accident. uh, so thank you. This ends my session. I hope I try to cover as much as first aid I can. I mean, not exactly the BLS. I want to cover these topics also. So thank you so much, team IMT. If you have any questions, so just go on with that. And one more thing, I always want to mention: always respond, don't react. So this has a proper meaning. So respond, like whenever you are in such scenarios. So people who react, always people who react, they'll hyper they'll hyper excite if they have to do a prop. I mean, people who react, they don't exactly do what they have to do at that point of time. If you clearly think and respond, you'll do it better. So if you want, always people who want to give some help to any person, always respond. Reaction is nothing but hyper excitation. Response is actually what we need. Thank you so much. Any questions?
Shubheta, are you there?
Yes, ma'am. Yes.
So, are there any questions? If there are not, Shubheta, can you just do a vote of thanks? Really,
Sure.
really thank Dr. Teja.
Sure.
Thanks.
So, on behalf of IMT Hyderabad, we thank you for the great and the insightful session. Today, I'm very sure that my batchmates and my faculty members are right now being a little more medically aware. As you also said, with all these steps we can perform, starting from the basic life support steps that you have said, starting from providing the CPRs. We have got knowledge about the implementation of the AED, the disaster management, as you have shown the triad chart, because at the end we have to help each other. As you have correctly mentioned, sir, in the emergency situation, every second counts. So these sessions help us to learn to deal with any unforeseen, any emergency situation. So I'd like to thank you for this, for the great and for the knowledgeable session. And we hope that, God forbid, if any situation such as can arise, so we don't just react, we respond, and we can help to all any other fellow citizen who are in the need. So thank you so much, sir.
Yeah, thank you so much. And thanks for the wonderful response from all you IMT batch, I mean, IMT students. I just want to make it an interactive session. If it was an offline session, it would be more better. But because of the limitations we had, so we conducted it online. We asked a prime hospital as doctor. I mean, you already you know our CEO Devan, and he's very good with collaborations. And we hope if you want any medical support and such kind of in emergency situations, we are always here, and you can have a contact number through our CEO. So thank you so much. Thank you so much, ma'am, for your patience.
Thank you, doctor. We will get in touch with you. Where if I mean, I hope we don't have to, but if we if we need, if the need arises, surely we'll get in touch, because and this was such a wonderful session. Thank you once again.
Yeah, thank you so much. I'm leaving the session. Thank you.